Detroit is known as a symbol of rebirth, but the city's true strength lies not only in its new buildings, but also in the resilience of its lesser-known communities. Join us as we explore a different Detroit where residents face daily challenges with housing and basic services. This is not a story of falling, but of an extraordinary journey of recovery. Of the quiet community efforts and solidarity to rebuild their lives, a fight for tomorrow that they are not alone in. Number 1 overview of Detroit's homeless in 2024 Detroit. Long celebrated for its automotive legacy and vibrant industrial spirit, now shoulders a quieter yet unyielding challenge, the daily struggle of thousands with no safe place to call home. While headlines spotlight glossy redevelopment and downtown's research, the reality of homelessness remains largely out of view. The Point in Time survey on the night of January 31, 2024, counted 1,725 individuals without secure housing. Of these, 1 to 420 found temporary refuge in emergency shelters or transitional programs, while 305 braved the cold in tents on benches or within abandoned buildings. This figure marks an increase from about 1,482 the year before, signaling a concerning upward shift despite continued investment. Equally alarming, 455 of those counted were children who had endured nights without shelter, a stark jump from 312 the prior year. Looking beyond yearly counts reveals a deeper issue. For every 5 households that secure long-term housing, more than one, roughly 21%, returns to homelessness within 2 years. This revolving door highlights just how precarious recovery can be for those living on the edge. Resources are not absent. Detroit has received $40 million from the Department of Housing and Urban Development, $5 million from the ARPA Relief Fund, and $2.4 million from the local budget for outreach. Yet these resources often dissipate in the gaps of a straining system, like water leaking from a cracked container. The average shelter stay is about 4 months, but that short respite rarely rebuilds a life. Without steady work, attainable housing, and reliable access to care, many return to the streets, exposed to both financial hardship and the growing hurdles found in Detroit's most vulnerable neighborhoods. A persistent challenge continues to move quietly through these spaces, impacting those already on the margins and making the pathway forward steeper than ever. Number 2, the silent challenge in Detroit. Not every obstacle comes with warning signs. Beneath the faint glow of streetlights over rows of makeshift tents, an invisible wave moves quietly through the city, testing the resilience of an already fragile community. State health data from 2023 shows that a majority of fatal emergencies in Michigan were tied to a potent public health challenge, one so concentrated that even the smallest trace can have significant consequences. Often people encounter it unknowingly hidden within other materials, turning routine use into a life-threatening event. This is not just a public health figure. It is a daily hurdle in neighborhoods where vulnerability is constant. The impact is measured not just in hospital statistics, but in the growing demand for emergency response. With each incident, outreach teams like those from Mariners Inn are on the front lines working tirelessly to provide immediate care and foster hope. However, they report that the sheer volume of crises is straining their resources. For those already battling freezing nights and hunger, this unseen challenge drains mental and physical reserves, making the road back to stability even more difficult. This obstacle does not arrive alone. It triggers a ripple effect. Poor health reduces the ability to work, loss of income, undermines housing stability, and stress within shelters or camps often sparks conflict. Hospitals shoulder mounting expenses while police respond to more calls that have no simple enforcement solution. For those walking the streets to offer help, the mission goes beyond saving lives. It is about keeping hope alive in places where it fades quickly. Many describe the situation as a current pulling people deeper each time they try to climb out. Physical injuries can be treated, but rebuilding trust, dignity, and the belief in new pathways forward is far more complex. This growing hurdle is more than a health challenge. It is a barrier that weakens housing initiatives and challenges community safety. If it is left unaddressed, even the strongest recovery programs may not withstand its pressure. The question now is whether Detroit is ready to face this hidden obstacle before it grows even stronger. Number 3. The breakpoint between two crises. For Detroit's most vulnerable life without a home is already a relentless trial, braving freezing winds, searching for a warm meal, and finding safety in unpredictable surroundings. Yet layered over these hardships is another challenge, one that tests the path to recovery before it can take root. Outreach teams say nearly 1 in 5 people experiencing homelessness in the city also face severe long-term health struggles. In recent years, this struggle has been compounded by a public health crisis that has reshaped the landscape of street life. State data from 2023 confirms a surge in medical emergencies, showing how deeply this challenge has penetrated fragile neighborhoods. What makes this crisis uniquely damaging is not just the immediate harm, but how it alters a person's focus. When someone is in constant pain or distress, the idea of keeping a job or paying rent fades into the background, says a nurse at a downtown outreach clinic. Survival becomes the only priority, pushing long-term stability further out of reach. Those on the front lines see how easily people are drawn back into danger. Thomas Hunter, once without a home himself and now heading a rapid response outreach team, describes meeting the same individuals again and again. You can open a door for someone, he says, but if the storm outside never stops, it's only a matter of time before they're pushed back through it. This collision of unsafe housing and street-level hurdles sets off a chain that is hard to break. Unstable shelter leaves people exposed. That exposure increases the risks they face, and each crisis makes the road ahead more uncertain. To disrupt this cycle, solutions must work on both fronts at once, offering secure housing while delivering consistent medical care, counseling, and community effort, until the city builds a framework that holds people steady. After they step inside, Detroit will continue to see lives stalled at the intersection of two powerful crises. Number 4. Strain on the safety net. Last year alone, Detroit's hospitals saw nearly 14,000 emergency room visits from people experiencing homelessness care that came with a price tag of about $17 million. Much of that cost was uncompensated, leaving public systems to absorb the expense. It's the kind of figure that sparks a hard question. What if the same money had been invested in long-term housing and support? The city's law enforcement budget tells a similar story. Over 5,000 arrests for minor infractions, loitering, trespassing, panhandling were logged in the same year. Each arrest carries costs for processing, transport, and jail time, often exceeding what it would take to provide supportive housing for the same person. For many, these encounters lead back to the street rather than toward stability. And even when resources exist, the human infrastructure to connect people with them is stretched thin. Just 60 full-time case managers are responsible for more than 100 to 700 clients each night, nearly triple the caseload recommended by best practice standards. It's a workload that forces triage, leaving some needs unmet simply because there aren't enough hands to help. The housing shortage compounds the problem. Detroit would need at least 5,000 additional affordable units to make a meaningful dent in chronic homelessness. Yet for those who do secure a spot, the process can be daunting: up to 15 separate forms, 5 different ID and multiple agency visits. Each delay risks losing someone to the instability they're trying to escape. As one veteran outreach worker put it, "We know how to solve parts of the problem, but the system is built for emergencies, not for prevention." Until the city shifts from crisis management to sustained investment in housing and human support, these numbers will remain stubbornly high, and the safety net will keep fraying under the weight. Number 5. Response and rescue initiatives. In a city where the challenges can feel relentless, there are places and people proving that change is possible, one life at a time. This is a story of resilience. On Cass Avenue, Mariners Inn is completely redefining what street-level outreach means. Picture their mobile units not just as vans, but as lifelines on wheels. Stocked with life-saving naloxone harm reduction supplies and a bridge to medication-assisted treatment, they travel directly into the heart of the crisis. They meet people on sidewalks and in encampments, not just to hand out resources, but to build trust, something that only comes from showing up consistently. The result of their persistence is a 14% reduction in overdose-related deaths in their service area over the past year, a testament to how dedication and community effort can change reality. Then there's the Opioid Quick Response Team led by Thomas Hunter, a man whose personal story fuels his mission. Having faced the same struggles he now helps others overcome, Hunter knows that time is everything. Within hours of an incident, his team is on site with survivors. The goal is not just to save a life, Hunter explains, but to give that life a sense of hope and a reason to live. These efforts are being bolstered by new funding streams. Between 2025 and 2027, Detroit will receive $40 million from the Department of Housing and Urban Development, alongside $2.4 million dedicated specifically to outreach. These funds offer a pathway forward to scale up what's already working. Expanding mobile units, increasing the number of rapid response teams, and bridging the gap between emergency intervention and long-term recovery. What these initiatives share is an understanding that time matters. Every hour after a crisis is a window, one that can either close, sending someone back into the cycle, or open toward recovery and security. The work of Mariners Inn, the Quick Response Team, and countless unnamed outreach workers. Number 6. Human stories. Beyond the statistics and headlines are the stories of transformation. In Detroit, 2 lives stand out, not because they are unique, but because they reflect the incredible resilience quietly present in so many others. Their journeys are not just stories of survival. They are powerful testaments to the effectiveness of compassionate, rapid intervention care. What happened to them is not just a stroke of luck, it's the result of community effort showing up at the right time. Thomas Hunter is the first example. Years ago, he was caught in the grip of addiction and homelessness. His turning point came when an outreach worker refused to give up on him. Today, the man who was once saved now leads Detroit's Quick Response Team. His words carry the weight of experience. "I know the pain and despair, and I also know with the right people in your corner how it can help somebody transform their lives and find hope." Under his leadership, his team has reached over 800 people, with dozens now on stable pathways to recovery. And then there is Robert, a man who nearly became another statistic. On a freezing winter night, he collapsed. The Mariners Inn mobile team arrived in time, reviving him with naloxone. That night could have been my last Robert recalls. Instead, it became the first night of the rest of my life. Today, he's clean enrolled in Mariners Inn's structured recovery program and speaks at community events to share his story of hope. Every milestone, a month of sobriety, a counseling session, and his renewed connection with family are victories he never imagined possible. What happened to Thomas and Robert is not just a stroke of luck. It is the result of someone showing up at exactly the right moment with the right tools and the belief that life is worth saving. Their journeys prove that recovery is possible when compassion meets action. And they remind us that behind the statistics are human beings who, when given a chance, can rewrite their futures. The challenge is making sure those chances are never left to chance. Number 7. The gaps and urgent needs stories like those of Thomas and Robert prove that recovery and stability are possible. They also reveal the distance that still separates hope from lasting change. Detroit's current approach, while life-saving, has yet to prevent too many from slipping back through the cracks. A major gap lies in the way housing and healthcare are addressed separately. Without treatment for long-term health challenges and mental health services woven directly into the housing, Mabbush's first model, a roof, may serve as only a short pause rather than a foundation for rebuilding. Safe shelter must be paired with the tools to heal, or the cycle of obstacles begins again. Another pressing need is the human infrastructure to connect people with help. Social workers and managers act as the bridge between immediate relief and long-term stability. Yet their numbers remain too low for the demand. Strengthening this workforce through community effort is as critical as constructing new apartments. To maximize their impact, Detroit requires a unified system, one where healthcare providers, housing agencies, and community organizations share data in real time, creating clear pathways forward and allowing them to identify needs before they escalate into crises. Partnership is also essential. City government can shape policy and provide funding. Businesses can contribute resources and open employment pathways. Community groups bring trust and on-the-ground knowledge that large systems often lack. When these forces move in the same direction, they create more than a list of services. They build a safety net capable of holding people steady during their recovery. The work ahead demands the same urgency shown during emergency response. Each day, without integration, coordination, and shared commitment, it risks erasing the fragile progress that individuals have fought to achieve. As Detroit defines its future, the measure of success will not be its skyline, but whether its most vulnerable residents can stand securely beneath it. Number 8. What comes next for Detroit? Detroit is not the only city facing increasingly complex social issues, but it might be the one to lead the way forward. Across the United States, cities are grappling with multiple crises: rising homelessness, worsening street-level emergencies, and support systems that are evolving far too slowly. But Detroit, with its deep history of reinvention and resilient communities, now stands at a pivotal moment. In 2025, a new wave of action is taking shape. Safe Steps Detroit is more than a pilot program. It's the vanguard of a new philosophy. This collaboration between clinics, housing authorities, and recovery services is designed to break the cycle from the start. By combining emergency medical care, temporary housing, and trauma-informed counseling all under one roof, it promises a seamless pathway forward. While the program starts small, just 60 beds in its initial phase, its design reflects hard-earned lessons. Treat the person, not just the problem, and treat them as early as possible. Alongside these new initiatives, technology is playing an increasingly vital role. Outreach workers now carry mobile dashboards that track real-time shelter availability and urgent care response times, allowing faster and more targeted intervention. These tools, backed by nonprofit and city partnerships, are helping to prevent the gaps from becoming deadly voids. But technology and funding are not enough. Real change demands a cultural shift, a refusal to accept homelessness and health crises as inevitable features of urban life. That means listening, truly listening to those who've lived it, including people with real-life experience in policy-making, outreach planning, and community rebuilding. It requires shifting how society sees the issue, from blame to understanding, from punishment to prevention. And above all, recognizing that recovery is never a straight line. There will be setbacks. But each time someone is given another chance, we move closer to a city that leaves no one behind. The road ahead will not be easy. But the pathways forward are becoming increasingly clear. From emergency rooms to City Hall, from warming shelters to cold street corners, Detroit is slowly shaping a future rooted in both resilience and shared responsibility. And the question now is no longer what the city has endured, but what kind of community Detroit is ready to become. Detroit is a city built on resilience, from the assembly lines that once powered the nation to the communities struggling to rebuild today. But for all the new developments and talk of rebirth, the challenge remains clear. Thousands of people still lack stable housing. Emergency shelters are overflowing, and a street-level hurdle is testing the path to recovery. This is not the story printed on tourist brochures, but it is the story that defines Detroit's progress. The pathway forward is clear: integrating housing with healthcare, expanding the workforce that connects people to services, and uniting government, business, and community in a common mission. Detroit's true comeback will not be measured by new buildings or thriving neighborhoods, but by whether the city's most vulnerable residents can live safely with dignity and hope in the city they call home. If you want more perspectives on homelessness around the world, check out our channel. Don't forget to like this video, subscribe to NVL Travel Documentary, and share your views.